Hi there. Today, I'll be discussing 7 signs that may indicate your heart isn't functioning properly. As you may know, cardiovascular diseases are the leading cause of death worldwide. In this video, I'll be splitting the discussion into 3 parts. The first part covers the 7 signs that you can visually observe when something is wrong with your heart. The second part deals with the 7 classic symptoms that you may experience when your heart isn't functioning correctly. Lastly, I'll share some valuable tips to help you prevent heart problems in the future. Please enjoy and share the video with your friends and family. By doing so, you may help save lives. Let's start by discussing the 7 signs that may indicate a heart problem. The first sign is known as Frank's sign, which is a diagonal crease in the ear. Dr. Sanders Frank first noticed this crease in the 1970s in his patients with angina pectoris. The mark is thought to be related to blockages in the coronary or carotid arteries. However, not everyone with the crease has blockages. Out of 100 people with the diagonal crease, only 70 may have blockages, and the sensitivity of the sign is low. Stay tuned for the next parts of the video, where we'll delve deeper into the other signs and symptoms and share tips on how to prevent heart problems. Sign 6, leg hair loss. If you experience hair loss first in your legs and then in your thighs, it could be an indication of peripheral artery disease, which is the blockage of arteries in your legs. Since atherosclerosis is not limited to a specific area but is a systemic disease, blockages in your leg arteries can also mean blockages in other arteries throughout your body, including the coronary arteries that supply your heart. Leg hair loss happens because hair follicles require nutrients for growth, which they get from good blood circulation. Blocked arteries due to fatty deposits will not provide sufficient oxygen and blood supply. While leg hair loss is a sign of peripheral artery disease, it may also occur for other reasons, such as genetic factors or rubbing against pants. Sign 5, xanthelasma. Xanthelasma is a yellow spot on the eyelid that is not painful and is mostly a cosmetic concern. It is a type of cholesterol deposit in the skin and is commonly found in middle-aged women, usually in the inner corner of the eye or less often on the upper eyelid. About 50% of people with xanthelasma also have dyslipidemia, which is high cholesterol or triglycerides. Interestingly, only 1% of people with high cholesterol develop xanthelasma. However, having xanthelasma increases the risk of heart disease, heart attack, and stroke. Therefore, it's crucial to have a blood test to measure cholesterol and triglycerides if you have xanthelasma. Sign 4, arcus senilis or aging halo. Arcus senilis, also known as an aging halo, is a condition associated with aging and is more common in older people. It happens due to cholesterol deposits on the edge of the cornea, causing a white or gray appearance above and below the outer part of the cornea. In some cases, the aging halo may dominate the iris, which is the colored part of the eye, making it appear lighter. Arcus senilis does not affect vision or require treatment. However, if it occurs in people younger than 45 years old, it may be a sign of severe dyslipidemia or high cholesterol and triglycerides. In this scenario, an increased risk of heart disease is associated with certain symptoms. If you are elderly and have arch dementia, it is normal to experience this risk. Aging arc, which affects about 60% of people over 60 and nearly 100% of those over 80, should not be a cause for concern. Another symptom to be aware of is cyanosis, which causes the skin to turn bluish or purple. While cold temperatures can cause this discoloration, it could also be a sign of a heart or lung problem. If an area of skin turns bluish or purple while hot, it could indicate insufficient oxygenated blood flow due to artery blockage. Shortness of breath may point to a lung problem such as pneumonia or emphysema or heart failure when the heart cannot pump enough oxygenated blood. Arterial ulcers that do not heal on the legs or feet may indicate poor circulation due to artery insufficiency or blockage, leading to pain, cramps, or tiredness. Nerve damage such as diabetic neuropathy may cause no pain in these ulcers. Venous ulcers, on the other hand, are more common and affect the inside of the leg. They usually cause bleeding and are related to varicose veins or venous thrombosis. Swelling of the legs, ankles, and feet, also known as edema, is another symptom caused by a weak or enlarged heart that causes fluid buildup in the body. There are 7 symptoms to be aware of that may indicate a heart problem. The first symptom is shortness of breath, particularly when performing physical activities. The second symptom is a persistent cough with white or pink sputum, which may signify fluid in the lungs. The third symptom is shortness of breath when lying down, which may cause the person to use more pillows or even sleep in a chair. They may also experience paroxysmal nocturnal dyspnea or choking during the night. General weakness and tiredness, difficulty with daily activities, and nocturia or frequent nighttime urination are the fourth, fifth, and sixth symptoms, respectively. Intermittent claudication, which is pain in the calf when walking that subsides when resting, is the sixth symptom. The final symptom is chest pain or discomfort that lasts for more than a few minutes, which may spread to other areas of the body such as the left arm, neck, back, jaw, stomach, or both elbows. Sweating, pallor, nausea, and dizziness may or may not accompany this symptom. Chest pain should always be considered a potential heart problem and ruled out as a possibility. If you're experiencing any of these symptoms, it's crucial to seek medical attention as soon as possible. But what steps can you take to prevent heart problems? Here are some recommendations. 1. Engage in physical exercise regularly. Regular physical activity is essential for your heart health, circulation, and mental well-being. Low-impact exercises such as walking, cycling, and swimming can also help improve blood flow caused by chronic blockages in your veins and arteries. 2. If you smoke, quit smoking. Smoking is one of the worst things you can do for your health. It causes impotence, inflames arteries, and increases the risk of heart attack, stroke, and dementia. 3. If you're overweight or obese, try to lose weight. Excess weight raises blood pressure, worsens blood sugar levels, causes inflammation, and puts stress on your heart, kidneys, joints, and venous system, increasing the risk of blood clots and fatty liver disease. 4. Eat a healthy diet that includes lots of fruits, vegetables, fiber, whole grains, and olive oil, and limit your intake of red meat and processed foods. If you have a family history of heart problems, especially a parent or sibling with a history of heart attack, stroke, stent or heart surgery, it's important to be more vigilant. 5. Manage your cholesterol and triglyceride levels. Consume more oats, reduce your intake of trans fats and saturated fats. 6. Keep your blood sugar levels under control. If you have diabetes or prediabetes, managing your blood sugar levels will help reduce the risk of complications. 7. Manage your blood pressure. Aim to keep your blood pressure below 120/80, or no higher than 140/90. If you suspect that you have a heart problem, experience multiple symptoms, or have a family history of heart problems, seek medical attention and follow your doctor's advice. If you found this video helpful, please share it with others.